So you are welcome to session 12, nursing care of the sick child in the hospital and the community. And our objectives are that by the end of this, you'll be able to promote health in children and discuss the ill health of the child and family, the effects that ill health has on the child and the family, the challenges that the hospitalized child faces or experiences, discuss the role of the parents and the nurse in increasing positive climate or help the child deal with these stressful situations, and educate families on nutrition and activities of daily living, and also provide education on activities of daily living and nutrition for sick children in the community. So it's important to note that hospitalized children are faced, or the sick child already is stressed, and hospitalization is also an additional stress to the child no matter the age. And illness and hospital are both stressful, and they disrupt the child's life and interfere with the normal development. It also affects not only the sick child but the family and friends. And so this session will look at all this and look at specifically the care of the sick child in the hospital and the children and the community. So basically, the key topics are the care of the sick child in the community and the care of the sick child in the hospital. So to start with, whether in the hospital or the community, what are the factors that promote ill health in the child? So the child, the family, and the community are key indicators to look at. So the factors that are the child-related factors are that the child could be born with congenital anomalies. So if he has a heart defect, or he has some inherited abnormal genes, as you may see in the sickle cell child, or has some acquired infection, especially in our endemic part of the world where malaria is endemic. So all these factors are considered under the child. And then the family. Birth spacing. When families have children at very short intervals, what we'll call in our local parlance, shipon haji. The mother does not recover fully from the stress of pregnancy and does not have enough time to care for the first, and to her own surprise, the second child is born, adding on to stress and then also affecting all spheres of the family income, space, psychological preparation, and all that. So there is so much stress put on the family when birth spacing is short and you don't have adequate support. It can be very difficult. And then low socioeconomic status. So we know that when the family does not have good income, it affects the nutrition, it affects where they live, and even the type of care that they can seek. And many more. So I'll leave that for you to discuss further. And under community, we are looking at poor community support. In cases where all farmlands are sold out and the family is left with no farmlands, how does it care for its family? And it is also important to know that the community behavioral risk, especially in cases where there is unhygienic practices like free defecation in the community or indiscriminate defecation, and then poor sanitation, all these go a long way to affect the health of the child in the community. So now we'll look at the effects of the ill health on the child and the family. He's saying that the sick child most of the time is unhappy because of the demand of the illness on the child. Child is in pain, the heart is beating faster, and so have increased fluid and nutrient requirements and the energy requirement. that need to be supplied by the body. And the child may be able to keep up with academic work if illness is frequent. And the child also may be challenged to maintain with social interaction, because if a child is sick and goes out of school for a week, for the child to cope with a week school work can be challenging and can lead to poor academic performance. And there may also be increased stress on the family's income, because the little they have to use some to pay hospital bills, buy drugs, and the like. And also gives additional challenge to the family as a whole, because there is a need for somebody who is familiar to the child to be with the child if the child is hospitalized. And if this mother does not have support, how is she going to make time to be in the hospital and at the same time care for other young children in the family? So it can bring about a lot of tension in the home. So it is important to know that when factors that are up in this diagram, like infections and poor feeding or malnutrition, is addressed, growth failure will also be addressed. And this, to a large extent, one thing leads to the other. So when there is frequent infections, there is also the problem of slow recovery. And then you see that the condition progresses to become chronic. And so it may result in undernutrition, and then this may get severe and result in malnutrition. And also, when all these factors come together, will result in death. So there is a need for us to prevent these occurrences. It is also very important that we note that the ill child has some problems, like less appetite, and they also have the problem of also loss of appetite goes with less thirst and increased fluid loss. The ill child has some challenges. There is less or poor appetite because of the illness, and the child may not be able to take in adequate fluid, though the body may be demanding for more because the heart rate and others increase. That signify need for increased fluid intake. However, the appetite to replenish is not there. And so there is a need for us as health professionals to teach the family, especially the caregiver, either the mother or the father or whoever is present, to continue feeding, especially if it's under 6 months or 2 years, then breastfeeding must be continued. And also, the breast milk is the best at this time in children below 6 months because it is easily digestible, and also increasing the fluid intake of the child at this point is very important. So we need to teach so that the parents or the caregiver will do this adequately. Furthermore, it is important that we note that good nutrition is very important for the infant and children to grow well, even in ill health, and it aids recovery and prevents future illness and promotes weight gain after illness. So nutrition is very, very important, and there is a need for us to emphasize this. So as health professionals, we need to assess the nutritional status of all children that we come into contact with. And so one of the things we can ask is, can you tell me, by asking the caregiver, what your child eats typically in a day? So in a day, how many times do you feed this child? So you have to elicit this. On the average, we know that a child should take about 8 feeds, including night feeds. So the number of times will tell you whether the child is receiving enough or not. Further, find out by the MCAI protocol what Does your child receive their own servings? If the child is up to the age where he can feed himself. Or do you have communal feeding? Because if you serve the child, then you are able to know how much the child has eaten. Who feeds the child their meals? Now we are encouraging responsive feeding. In cases where children have loss of appetite or don't eat well, it's very important that we come in to feed them. Does your child take any milk? What type of milk does your child take or drink? How much milk does the child drink per day? Because we know that milk is very nutritious for children. In cases where the mother is introducing formula, through this question, it can be elicited. In cultures where mothers or families give their children additional milk, some even will use fresh goat milk. When you elicit this, you have to further find out whether it is pasteurized, and if not, encourage family to boil, because it can also be a source of infection. Does your child drink anything else beside milk and water? If yes, find out how much of each. And does your child have any concern about how much or what your child eats each day? So you find out what the mother or the caregiver's concerns are concerning the child's food intake. And with this questioning, you should be able to assess adequately how much the child is getting, and it will inform you on what you are seeing clinically. Daily activities. We know that daily the child must bathe, the child will eat, and the child develops some skill by crawling, rolling, running. All these you want to elicit. There are some cultural and traditional beliefs as a communities that will say that diseases like chickenpox, for example, the child should not bathe. Rather, they may use something like local alcohol like aquatation to smear the skin. So you need to find out some of the activities of daily living and whether the child is able to perform this or needs support. But by way of activity, as I have put on the screen, as a class, let us write down detailed list of typical day in a child age, in a typical school age child. In a day, what are some of the activities this child will perform? Write it down. Think of all the activities of a day, both at home and in school, and write them down. After the list is completed, go through each item and identify which ones a child with acute illness can perform. And then you may even go further and find out which ones a child with chronic illness can perform. I think the essence of this exercise is to let you know that the child with acute illness needs support. However, a child with chronic illness that is well managed may live near normal lives. So when we baby them, we also affect their development. Take time to look at this exercise. Community management of the sick child. In the community, we come across sick children. They may be in the school, they may be at home, they may be in marketplaces, or even in vehicles. But in our management, we are looking at prevention. Primary prevention is preventing the problem from occurring. Therefore, you are promoting health. And so it goes with education to community members. An example of these will be wearing of, let's say, helmet, or telling children not to play with sticks to hurt their eyes, and teaching families on how to prevent burns at home when they are cooking, not to leave children unsupervised, and to cover all electrical gadgets or sockets that are exposed to prevent electrocution. and also to cover barrels that are in the compounds to prevent our children from drowning. And even talking about provision of latrine to prevent open defecation that is resulting in outbreaks of cholera in our part of the world. All these go under primary prevention. Secondary prevention, however, comes when you go into the community and then we do something like screening tests, like test screening for tuberculosis, or providing counseling in certain stressful situations like divorce, or even cervical screening. Because we know that in cases of cervical cancer, which is second on the cancer death list, this can be prevented when screening test is done. It takes over 10 to 15 years for cancer like cervical cancer to occur, especially in our mothers. When you lose a mother, you also affect the health of the child. So we encourage all these screening for early identification and treatment. And in tertiary prevention, the condition has already happened or occurred, and then we further give some physiotherapy to prevent further complications. So for example, if you have a child with burns, encouraging move limbs and other things will prevent contractures. So our take-home message is that illness should not necessarily limit the daily activities of the child. Accommodation should be made in order that the child will continue to function at the highest level as possible. So now we're going to look at challenges or care of the child in hospital. And we have already said that hospitalization is very stressful for a child at any age. And some challenges that the hospitalized child may have is that the child may be afraid of the environment because it's unfamiliar. And also afraid of some of the painful procedures that occur in the hospital. And the child will also miss friends and family, depending on the age. And younger children are more used to their parents, so their presence is very comforting. The child may be bored, and there is false belief. The child may see being in hospital as something he has done and that warrants him or her to be punished. And the child may be developed in terms of other language and other abilities, but may not understand why he or she is hospitalized. So these challenges we must appreciate so that it will help us educate the family, especially the caregiver, and also promote family-centered care. Also, the effects of hospitalization on children, we said, differ at various ages. And so some factors are the age, the reason why the child is being hospitalized, the temperament of the child, and family support. These are factors that we need to consider when considering some of the challenges. So here I have some challenges that a child from birth to 1 year may experience. Development. We are saying that the newborn is developing his or her new skills like rolling, crawling, and all that. So when is in hospital, this is limited because there will not be enough space to walk and crawl and jump. Poor stimulation. There is not enough sensory stimulation in the hospital. Sunlight exposure is limited. There's no music, there's no toys. So these will affect the development of the child. And relationship. the bond between the mother or the caregiver and the child to a large extent is affected, most especially when they are not always around, or sometimes the mother may be sick and away from the newborn. And so this can affect the bond or the relationship between the child or the infant and other significant family members. It is also important to consider children between 1 year to 2 years. Their development is also affected because of limited opportunity to develop their new skills. Also, we are saying that the activity of daily living is also affected because it may be disturbed. In the hospital, the mother may realize that the sleeping and eating patterns may change, all because of unfamiliar environment. But this, with time, will improve, especially after discharge. And then emotional development. The child will find it difficult to trust the many staffs we have in the hospital, and also will find it also very stressful dealing with different people almost throughout the day. How about children 2 years to 11 years? Also have some emotional challenges because the hospital environment, we have painful procedures. And then their perception may also be challenged. They may believe they did something wrong to be in hospital as punishment. They may have limited understanding. And then some of the communications we have around them may be misunderstood. Children 12 years and older also may have some psychological challenges for being hospitalized. There is also a very stressful for them, and they also will need privacy, especially when it comes to dealing with adolescents. If you take away their privacy, you have disturbed them. We need to respect some of these things. Hence the need to discuss all these and also be able to address their concerns appropriately, and also work with caregivers and promote family-centered care. For our activity, how do we address the challenges of sick children in hospital? I have few cues here: family-centered care, facility design, and nursing care. How do we address these challenges? Looking at least these 3 major areas. Take time to exercise. It is important to note that when it comes to family-centered care, we see the family and caregivers as an important part of the care we are giving in the hospital. So we involve them at each phase of the care. We elicit their views because they know the children better. We give them the necessary information so they can speak to their children and also address some of their concerns along with them, and speak to the child in a language that he or she understands. And this requires that we respect the perspective and the cultural beliefs of the family. And it also will inform the policy and also even the design of the hospital to take into consideration the needs of the child and family. So then the facility should be child-friendly. Should have room for paintings on the wall with some toys. It must have a library where the children can have some books to read. It must have a playroom where children can play depending on the state of their condition. And even television that they can view some children's channel. There must be room for the mother to rest. In our parts or in Ghana, mothers who stay by their children, or you see a mother who has recently delivered and she will sit by the newborn throughout. the day and at night. This is stressful and can make the mother also ill. So we need to have room for them, our space created with some flexible chairs that they can raise their feet and relax their backs. And there's a need for us to provide them with a psychological support, even if it means bringing somebody forward, encouraging somebody in the home to come and support the mother. And also need to group our nursing actions to promote rest. And in cases where there are alternatives, we need to reduce the painful procedures. So say, for example, if the child can take syrup, depending on the condition, then we should not go for injections. And many more are some of the things we can do, not forgetting the needs of the adolescent, privacy and respect, and involving them throughout all that we do. So we have some reading lists and also some scholarly articles that addresses the care of the sick child in the hospital, or some even fact sheets from some renowned hospitals will inform you about some of the things we need to look at. So this will help you read further and address the issues appropriately.